Very warm welcome to everyone joining us today. And we're really excited to have this session, Building Your Pathway to Postgraduate Research, Postdoctoral Opportunities, and Academic Excellence, that is hosted by the Journal Club, IMIG. Today's session is all about exploring your journey beyond MBBS and understanding basically how to build a successful future in research and academia. And we're honored to have been joined by Professor Dr. Mohammad Liaquat Raza, who will be sharing his valuable experience, practical guidance, and insights to help us navigate global research opportunities and academic growth. And we really hope this session inspires you and gives you all the meaningful directions that you need for your future careers. So, Dr. Liaquat, over to you. And I hope everyone can get benefit from this session and Dr. Liaquat's experience.
Bismillah Rahman Rahim. Assalamu alaikum to everyone, and thank you, Varisha, for inviting me to address a topic which is very essential and very much needed, especially in this time of the academia, where a lot of things has been changing, especially in terms of research, in terms of publication, and the new era of research is going to take a very different paradigm actually. So not a lot of people are aware of this because the transition of the teaching modalities and the future of the university teaching and the mode of teaching, the future classroom, and especially with the flooding of the AI stuff. So what is the future of research, and especially in terms of when we talk about the medicine field and healthcare and other allied healthcare professions. So in today's session, we're gonna discuss a very superficial one because we cannot cover everything. Because itself, the research journey is another very extensive topic, and when we talk about the career path, is another topic because there are so many linked skill with that. If you want to pick your career, there are a lot of soft skills that are connected with that, like how to write a good CV, how to approach your mentor, how to prepare for a interview, how to prepare for like a successful scholarship application, how to do a time management, and all these are like different soft skills that one should be basically embedded, and one should equip with these skills so that he can successfully grab the opportunities abroad. Because when we talk about the international paradigm, so a lot of people are applying from any country actually. So that means you have to compete them, and in order to compete them, you should have a lot of skill set in your in your CV as well, in yourself as well. Because when you send the CV, so you are not present physically, but when you are at the interview table, you are physically there. So there are a lot of things that can coincide, that can clash, that can give a sometime opposite reaction to the mentors or to the PIs. So this is very important. What we are written in CV, it should be aligned with yourself actually. Do not put some fancy stuff there which you are not aware of, or which you don't have a very good insightful on that topic. So because with a one single question, the PI and the interviewer can easily judge whether you know the topic or not, or you do have the skill set or not. So do not put anything which is not aligned with your personality, which is not aligned with your background. So these are the things that can give a very negative and a very bad impact on your, and not only the career but also like in the initial selection processes. Great. So, as you are all aware, like today's session is about like how can you build your career path as a medical graduate, especially if you are a fresh graduate. How can you find opportunities? What kind of roadmap you should follow? Actually, as I said in the beginning, like it's a whole journey. And if you are not, because when we talk about the journey philosophically, the journey has some milestones, some stops over, some stations. So if you are not aware of those stations, stopovers, so you will never able to reach your destination. So what we will discuss today, it will be covering a lot of points. For example, what should be the global opportunity options for the medical graduates, how you can build your research career roadmap as a fresh or as a new graduate in the field, how can you find scholarships and the fellowship abroad, because there are so many portals, there are so many scholarship opportunities, but we are not aware of that, how we can approach those scholarship portals and fellowships abroad, how can you build your academic profile very competitively. So because this is very important thing, as I mentioned earlier. So it's your CV, which is first impression of yourself, whether academically, whether professionally, whether knowledge wise. even as a person, because you also put your journal aims and objective in the CV actually. So that reflects how you think about your field and about yourself, about the society, about the field. So this is very important. You should have a very strong and very positive CV that can reflect you in a very positive way. And then how can you basically choose and adopt this field as a researcher, especially if you're a clinician? Because sometimes clinicians are struggling because they are very much engaged in, due to the workload in their clinics, in their wards, to deal the patients, and they have less time towards the research. So how can you adopt this transition from a pure clinician to a good researcher? So it's a whole journey, so we cannot cover everything as I mentioned before. So at the end of the lecture, if you have carefully listen all to these points, so you will be able to at least understand the basic superficial roadmap of your career pathway after your graduation, or if you're a fresh graduate. And you can also able to find how can you explore the opportunities which is already there in the internet, because every universities or organizations, when they have any openings for the PhD or the masters or a research associate level positions or a postdoc positions, so they advertise it in their portals. How can you approach these portal? What are the important portal where a lot of opportunities are already listed there? There are certain research journals, for example Nature and Science. They have a very strong, huge career portal. You can access the PhD opportunities there, you can access the postdoctoral opportunities there. So what are those important portal, we can discuss a little bit. So and then another important thing, as the lecture flow will move forward, you will able to understand how competitive this field is, which is research field. How can you compete others, because there are a lot of people who are always struggling to build a very strong research career, to have a good publications. They are actually not able to despite they are having good research data, but they are not able to successfully publish them. So what are those challenges, why they are not able to successfully publish, why they are actually fail to build a very strong research career in the field? And you can also identify different international fellowships in the field, whether if you're going to choose any specialty in the field, in the surgery, in the medicine, in gastroenterology or dermatology, whatever field you choose. How can you explore those fellowships in your field of interest? And then lastly, you can build your own practical, because this is very important. We have the lot of roadmap which you can find on the internet or maybe in many tutorials. The best thing is, like, everyone has their own scenario, everyone their own skill set. You have to build your own roadmap which should be practical and achievable. So if you follow others roadmap, might be possible you are successful, and there is a possibility you are not successful. But any roadmap that you will build your own based on your own skill set, based on your own knowledge, based on your own background scenario, then you are more likely, chances are there that you will be successful in this field actually. So to excel in the field of research, and to excel in the field of research with excellence, there are two different paradigms. Because a lot of people adopt the field of teaching and research, but they are not a good teacher or good researcher. So if you plan something, try to do the best. In order to do the best, you have to show your excellence. And excellence never comes when you are not passionate enough, when you are not dedicated, when you are not, from your inside. You have to feel that field actually. If you don't feel a particular, for example, if you have interest towards surgery, then you have to feel it from your inside. If your inside is telling, okay, this is the right place for you, then go for this. If anything which is which for which you are pushing yourself, that means actually you might face a lot of problem in achieving the excellence in that. So always go with your inner feelings. So whatever feels you the best, go for that. Never thinks what other will say, or never get influence from others opinion actually. So this is the key essence I'm telling in journal. If you want to excel in any field, whether you are a doctor, whether you are a engineer or IT specialist or accountant, so always, if you want to be a best, always look at your inside, your feelings. So whatever your inner feeling is, what your passion is, go with that. Because if you ask someone, everybody will give you their own experiences actually, and they have the different skill set, they have the different mindset. So always go with your own inbuilt mindset, own skill set, then you will be basically excellent in the field. This is very core essence if you want to be successful in any field. So this is, you can say, the golden sentence and the golden point of the of the career actually. So anyone stick with this, it definitely will get successful in the field with the flying colors actually. So you can definitely see around people who are struggling, and some are very much top on the field. Why? Because they've a different mindset actually. So they have built this thing with their own instinct, with their own passion, with their own skill set. So this is very important thing that you should keep in mind always. All right. So why this research is important, like as a medical graduate, why we should go for research, why it is important nowadays, and especially if you want to choose a field of academia, this is the must thing, because you cannot get a step forward without having a research skill set, without having the publication, because this is something at one end it is bad, because sometimes people just do research for the sake of their promotions actually, for the getting high ranks or getting some incentives actually. But a true researcher never look at this. So if you build your insight as a true researcher, definitely rest are the thing, are the secondary priorities actually. And if you are a very good researcher, everything will come next to you, whether it's promotion, whether it's incentivization in your field, you will be definitely a lead in the field actually, if you do it with your passion. So why it is important, as we have explained a lot of things before. So generally when we talk about after getting the graduation, if you want to pursue your career as a researcher or the physician scientist, so what the pathways which you can look at globally, and what are the trend nowadays. So first of all, you can be a researcher. It's not necessary you always do a wet lab work. Wet lab means basically you do experimentation sitting in the lab, using animals, using reagents, using drugs, and you apply on different models. You do some new drug discovery, applying a lot of different scientific techniques. You do drug discovery, you do optimization of the treatment, applying maybe computer based simulation, which is called CAD, or computer aided drug designing. You can develop new pathways that can help to identify the pathogenesis, such as the computational modeling. You can do futuristic predictions. For example, if you're working in epidemiology, what would be the future trend of the particular disease in your field. So that is all come with the different lab settings. So some are dry lab, some are wet lab. So the paradigm with the animal and drugs, it all comes with the wet lab work. And dry lab means like you do the simulation, you do the computer aided drug designing, you do the computational work, you do the modeling work, which doesn't require a physical testing in the animals on the humans. So this is called the dry lab work. Then there is a clinical lab work. So you, depending on your nature, depending on your mindset, you can choose a clinical track record as a physician scientist. So you can pick, basically, if you want to use a clinician with a research background, so what you have to do, you can pick one paradigm which is plain going for residency, which is in your field of interest, whether surgery, whether medicine, whether gastroenterology, neurology, whatever you feels more appealing for you. You can do the residency, then you do the fellowship to get more experience, and then you become consultant. In this journey, what you do, you develop your research skill from the clinical perspective. For example, you do the cohort study, you do the prospective, you do the longitudinal work, you do basically any kind of RCT to compare the two different drugs, their efficacy, you identify the side effect of the long regimen drugs. You can do the optimization of, in particular, for example, if you're a patient with the hypertension, along with you suffering from the cancer or renal disease, how can you optimize the particular drug treatment in that particular patient. So all these things will come in a clinical research. So you can build your career as a clinical research. But according to the in scientific community, the philosophy of the research is more lies towards doing something which can comes more with the lab work, such as you discover a new drug, you work on new receptors, you work on new pathogenesis mechanism. So all you have to do the wet lab work, because the wet lab work will enable you to explore not only the new drugs, but also the new receptor site, but also the new pathways for a pathogenesis. So that will help, basically that sets a benchmark to towards the new treatments actually. So that's why the most of the scientific community is more towards on this inclination, that the rare research is basically doing something in the lab at utilizing chemicals, utilizing animals. All these things come up super level of the research. So it's up to you. So if you are not with the more clinical skill set, more clinical insight, then you can choose you as a researcher applying the basic field, which is called the basic research. So you can, for example, if you have interest in hypertension, so you can look at the animal model which are for hypertension, and you can use the new drugs on that, whether the drug is able to reduce blood pressure or not. For example, if you're working if you have interest in neurology, you can look at the animal model of Alzheimer's or Parkinson's or epilepsy or multiple sclerosis or Huntington, and you can apply the new drugs and see, okay, whether the drug is going to stop this pathogenesis of the particular neurodegenerative diseases or not. These are the things you can do. In order to do this track record, what you have to do, you have to basically start soon after graduation. You can do some internship, research internship, so that you can build some scientific skill set, because it's a huge field. There are a lot of techniques you have to learn, because biochemical techniques are there, microscopic technique are there, then stem cell technology is there, genomic field is there, then you have basically other cellular level techniques, you have molecular level technique, you have system level techniques. You have to get master in some of the technique actually. For example, doing western blotting, electrophysiology, electron microscopy, immunohistochemistry, doing the cell assays. All these things are come as a skill set as a researcher. So depending on your own interest, pick one of the technique, two of the technique, and learn it. And after learning, you can start like some of the research assistant position, and then you can move yourself to a master level work, so that in the master you can apply those technique and do your thesis. And based on that, you apply for the PhD scholarships. And after PhD, if you want to become a faculty member, depending on the country where you are, so usually in the west, in the abroad, in the western country, you cannot become a faculty member directly with the PhD, as we see in Pakistan. In Pakistan, if you do PhD, you can be assistant professor actually. But in order to get the assistant professorship abroad, you have to do the postdoc. For example, give you an example, if you want to do a faculty level rank, so you have to finish two postdocs, depending on like which university, at least of 5 years postdoc. You should have the two postdoc with a 5 year duration actually. So this is something after PhD, and in America this is one of the dark side. So at least it's an average takes like 7 to 8 years to get the PhD in America actually. So this is another thing. When you choose a career path, you have to sue. For example, in the UK, it's a very structured PhD. You finish on time within 3 years. So depending on the country where you're obtaining your PhD, whether it's structured, that means you will finish on time. And if it is unstructured, like in most of the European country, or like in, as I said, in USA, it takes 7 to 8 years to get your PhD done. And then after that, you have to spend like 5 years and then apply for the assistant professorship in the university. So it's a long track, but again, I said, it's all passion that drags you towards this path. If you are really passionate for research, you want to invent something, you want to discover new drugs, you want to discover new receptor, you want to discover new pathways, you want to find out new pathologies, new things, then you have to actually follow this path. And second is basically as a hybrid path. You're kind of mixed thing in that. What you have basically, if you see a lot of US faculty members, they are MD PhD. So what you do, you start with clinical work and you do your PMD work, and with MD you can opt another program which is MD/PhD. Means you spend like 1.5 or 2 years to do a lab work that will conclude you towards MD PhD level degree. So you will get the two things, MD plus PhD. In a lot of European university, this is also an option where you can actually opt for like MD PhD program. So in which you have to spend extra 2 years. So in that 2 years, what you do, you basically stop your clinical studies, and then you spend time in lab and doing the work, which is PhD work, and then you write a paper or you do the 20 pages monograph. Based on that, you will be awarded the PhD along with the MD degree. So this is kind of the hybrid or mix record that you can add on. Then you have another track, and when we talk about it, it's like the industry, and on top of that you have two major industries. One is pharma industry, other is basically CROs, the contract research organizations or clinical research organizations. So if you are more in the clinical side, then you should use the track of the CROs. So there they are basically mainly performing the third party clinical trials, phase 1, phase 2, phase 3 trials. So those contract research organization hires basically clinicians and the physician as a PIs, and they will lead that particular phase 1, phase 2 trial. So this is another, but you have to have some previous record of the clinical research. You should have a very clear understanding of the dossier preparation for FDA, because if the drug trial is going to be successful, you have to basically move to a next level. And in order to move to a next level, like from phase 1 to phase 2, you have a lot of documentation, and these are very technical dossier that the team prepares for that. So if you don't have a very good knowledge of these clinical documentation, then definitely you will not be hired. So what you do, you basically, there are certain organizations like Craigard and all these things, they offer like 6 month internship, and they train the physician as a CROs. So you can start from there, and then you can choose. And then you have the pharma industry. And pharma industry, like one of because even in Pakistan there is no true R&D exists. So but they need in medical affairs department, they need in regulatory affairs, and then business development doctors, because of the connections they have in the industry, in the hospital, so they can grab the more business. So that's why pharma industry is one of another sector. But again, clarifying you, there is no real R&D existing in Pakistan. The R&D means Pakistan is just to do the bioequivalence study, like PKPD, like pharmacokinetic and pharmacodynamic study. They put like 10 volunteers and then give the medication, and then see they do the blood sampling from 1 hour, 0 hour, 1 hour, 10 hours, 12 and 24 and 48 hours, and run the HPLC and get the exact amount of drug in the blood and the urine and all that, and then they give you the report of the bioequivalence. So this is all the R&Ds in Pakistan. This is not R&D in pharma means in abroad, in Western country, means you develop new drugs, new drug for cancers, new drug for CNS disease, new drug for infectious diseases. All these comes in a real way of the R&D. So you have another option if you go abroad. So they have the real R&D, where they have a long range of pipeline from the different therapeutic domains, such as gastroenterology, respiratory medicine, the nephrology, and then neurology, and then oncology, immunology. They have developing new medication for the various conditions. So you can be a research scientist there. So these are the career pathway when we talk about, okay, what are the countries which are the very strong opportunities. So there are, I mean, most of the Western countries are there in the list, but we can talking in journal, and most of the work which is coming in terms of research is one of the top leading countries, basically US, because they have the huge funding. But at the moment, currently, it's now declining because of the lot of cut down of the NIH grant and other issues with the aspects. So I mean, it's no more longer a charming destination. I mean, I'm telling in a real ground. So these days, this is not the real place to go actually. So you have to look at other places. For example, Scandinavian countries is one of the very good option, like Sweden and Norway and Denmark. So they have also a good funding there. You can approach these countries if you are really pursuing the good research. UK is again very oldest history of the top leading university like Cambridge, Oxford, UCL, and University of Manchester, University of Birmingham. All these are very research focused institute. So they are developing all the time different new therapeutics for various diseases. So UK is another they have a very structured program there if you want to, because they have a two big organization there. One is basically BBRC, one is MRC. So they have a lot of funding for their graduates, for their fellows, which are basically MRC funded and BBRC funded projects there. And then another charming destination, especially for people who are from India, Pakistan, or these countries like Canada, because they have also a very rich program, CIHR there, which is basically Canadian Health Research Organization, which is actually funding, just like in USA, it's NIH, in UK it's NHS, in Canada there is CIHR. So they have a huge funding for their medical field in the different universities. So McGill is one of the top in the medical field. Then you have basically University of Toronto, you have University of British Columbia. They have a very good program running there in the different disciplines. So Canada is another charming place. The advantage in Canada, you can actually after 3 years apply for the PR. So if you work there for 3 years, and then definitely you can have an option to apply for the PR there. Then you have the Germany, very rich in research, because I did my doctorate from there, so I know a lot of things inside there in Germany. Heavily research funded, heavily research focus. A lot of new, you can imagine, like the university where I did my doctorate is a university. So out of imagine, like out of 42 Nobel laureate in medicine from Germany, 21 were graduated from that university. So it's one of the oldest medical university, like 300 years. When I was there was 300 celebrations of that university. So it's a very rich research focus, and Germans are very research oriented. So it's a very strong a place if you want to do a real science. Actually, people there do research for research, not for publication actually. Like in most of the country, you can notice like people are doing research for getting the grant, for getting the publication to increase the matrices. But in Germany, people mostly are doing research for research actually. The Max Planck Institute is one of the top rating institute. There are a lot of funding there, a lot of opportunities. Every month you can find new openings there, at the level of masters, PhD, and postdoctorate level. You have Dart basically one of the government institution who has lot of opportunities at the national level. So each country have, for example, the Pakistan has a, through the HEC have their pact. So a lot of Pakistani can go there and study free of cost. But the scholarship, the Dart pay is usually less than the Max Planck. I can tell, like if the Dart is paying like 1,000 euros, the Max Planck pays 16,000 euros. So it's a huge difference actually in the fellowship level. So this is and then Australia is another paradigm that you can look at. You have a lot of, I have a list in the band. For example, ANU and PGRC are the top Australian portals where you can look at a lot of opportunity. ANU is from the Australian National University. You have a huge portal of the various opportunities there. You can actually find a lot of options here. Then already mentioned Scandinavian country like Sweden, Denmark, Germany, Finland. You have a lot of opportunities there in the field actually. All right, why and what is the PhD means after you finish your the doctorate degree, you finish MBBS or a dentistry or even a PharmD or a physiotherapy DPT, or you finish your like BN, the Bachelor of Nursing. So whatever you finish, and if you are planning for PhD, remember, so you have to in 80 to 85 of percent countries or the places, you have to do a master's degree first, because there are very few places in the world, like in UK or in America, where you can directly go for the PhD level work if you have the upper grades in upper this is called the upper honors, in if you are talking about the UK terminology. So, and it's very few actually. So it's not you have to compete a lot actually, because there are local citizens there. There are people from other countries. There are resident there always. So citizen, resident, and then international applicants. So imagine how tough the competition is. But there is a possibility that you can directly jump into the PhD program if you have a very good grades and you do a very good scores in IELTS, and also in the basically, because if you go in US, you have to, for example, let's suppose the Albert Einstein Medical College or the Brown University. So what you have to do is basically you have to pass not only the journal GRE, but also you have to do the subject GRE. So that means you have to score a very high marks above 80%, and then IELTS, and then you have an upper honors grade in your bachelor's degree. Then you are basically subjected to directly inducted into the PhD program. So this is something you have to always consider. So generally, I mentioned like it could range from 3 years, like in for example in Italy, for example in Australia, for example in UK, where you have the structured PhD admission program. Then you can finish in 3 years. Otherwise, it might 6, 7, 8 years. I mentioned like in Canada, in UK, sorry, in Canada and USA, you might take like 7 to 8 years. Is an average actually. It's an average. Even in most of the German universities where there is not a structured program there, so it will take 5 years actually to get your PhD done. So these are things you always have to figure out how much years that you want to dedicate for these level work, because you will finish your MBBS, you do the house job, you do the residency or a RMOship, and then you apply for the masters, 2 years for the masters, and then you plan for the PhD actually. So this is something a long path. So I was explaining about postdoctorate work. So that means basically it is something which is actually far behind from right now where you are. So usually postdoctorate जो होता है वो basically after PhD, जब तक आपके पास PhD डिग्री ना हो तब तक नहीं होता वो. तो दैट मीन्स जो है वो आप जब PhD कर लेंगे उसके बाद आपकी जो है वो लेवल आता है पोस्ट डॉक्टरेट का. लेकिन इसके अंदर जो इम्पोर्टेंट चीज़ है बेसिकली आपको सुपरविजन जो है वो यूजुअली मिनिमल होती है कंपेयर टू पीएचडी because the PI asks you should work independently on the project. That means you have to execute the whole project, you have to find out all the findings, and then you come up with the publication, and then finally you reach to a supervisor, okay, I've done the project, this is the publication, give me your opinion. It's not like always back and forth you go and ask like, okay, I'm stuck here, what to do, what not to do. So PhD means supervision, and postdoctorate mean without supervision you have to execute your whole project, you have to write your own paper, because in PhD the supervisor and the other colleagues keep guiding you because you are new in the field. But at the postdoc level means you are doing everything independently, not only for research execution but also writing a paper. In the PhD your supervisor and senior will help you out in writing the paper, but in the postdoctorate level everyone expect you will do everything by yourself. Actually, this is something in certain universities, apart from your own project, you have to supervise other lab members which are doing the master and PhD. That means you also have other duties beside doing your own project. That means you should have the supervisory skills, because you will basically train other PhD and the masters working in the lab. So this is something usually it's very important actually. And how can you build your profile research in terms of research very strongly? So there are certain essential point. You should have a very good ability to do the literature search. You know how to use the PubMed, how to use the Embase, how to use the clinical trial work if you are interested in the clinical data work, how you can basically pull up and extract the data from the different studies, different portals. So if you are working in different fields, and if you are working in psychology, you should know how you can extract work from psych info. If you are doing nursing related work, you should know how can you extract data from Sinhal. All these things come in the skill of the literature search. Then you should know what the different type of studies are there, different type of publication are there, what does the case report means, what is the structure of the case report. How, if you are more passionate in the clinical research, like if you're working as a CRO or executing any clinical project, so you should know there should be the clinical audit. What are basically the clinical audit means, how you basically prepare their documents, what is basically the requirement of the your own internal hospital regulation. Apart from that, on top of that, you have the basically main national regulator that has some guidelines that you have to comply with them. So these comes all in the clinical audit that you have to look at and comply with that. Then you know what the meta analysis is, how you can perform the meta analysis. If you have already published work, how can you do the compile the RCTs and extract the data and do the meta analysis by performing the statistic analysis on that. So you can write the conference paper if you are expert enough. So all together you should know the basic skill set, whether is literature skills, whether it's biostatistics, is writing a good scientific paper, and how you can use the different softwares which are good for like doing the referencing, like the Mendeley or the Zotero, or the reference manager, or basically all these things come on that. And then you should know the skill of the data analysis, whether it's SPSS, that is R. If you are doing the computational work, you have the programming skill on Python and R, so you can do basically the data analysis on that. Then comes the next step when we talk about a very good researcher, what high value skill that you should develop. So technically, if you are doing research, whether it's clinical research, whether it's basically a basic research, in every research without a statistic, you cannot write a report, you cannot write a paper, you cannot write a thesis. So that means the statistic is something that is one of the very technical skill a true researcher should have. So in order to develop a skill in biostats, you should know the softwares. Basically, the main common software which are in the market and very much extensively in use by researchers is SPSS, which already you people are know, because a lot of people are using SPSS. And then we have the new program level statistical paradigm, which is called R. So R is a language using the different programming, and you can perform lot of statistical computation on a big data, on a large data, very quickly. So if you do the same thing in other software, it will take a lot of time. But if you do with the programming, by the programming, so you should know basically R is one of the one, and using the R, you should know the Python. Basically, if you know how to write in Python, you can do a lot of analysis done very quickly within few minutes. Actually, you can develop and modify the graphs as well using these programming model. It can come up with a very fancy graph that is not a traditional graph which is you see in the Excel and other software. So these are the things that you can actually, for example, imagine you have the data set of the 1 million data points. So if you want to compute the 1 million data points in SPSS, you have to prepare a lot of Excel file, and you have to tag them, and you cannot come up with a very right graph because the data set are too much. But this you can do in Python. Actually, this you can do in R. Actually, so if the huge data set you cannot compute in a normal software, that you can use basically these R based softwares, and it can generate a very good graph on that. So you should know the very high level of the art of doing this, to review the literature systematically, because nowadays there are certain guidelines. If you are going to publish a research, if it an observational study, you have to follow the STROP guideline. If you are doing the systematic review, you have to follow the PRISMA guideline. If you are doing like other type of study, the case series, or like the longitudinal studies, or basically other research, so there are guidelines for each kind of, so you have to follow the guidelines. So nowadays, if you want to perform a systematic review, there is a specific guideline, so you should know the methodology of doing the systematic review based on these guidelines. Then RADCAP is another thing. Maybe this thing could be new for you. So generally, when we talk about skill set, is basically RADCAP is one of, you can say, you can use virtually because it's an environment and it's a database where you can use. For example, there are a lot of guidelines by US, for example, HIPAA guideline, and in the Europe you have the GDPR guideline, and in other nations like such as CFR guidelines and FISMA guideline. So this is a dataset environment that you can use virtually and come up with your analysis. Actually, so maybe this is it was started as a project, and when the project is basically successful, now the software is available for that in the different environment that you can use, and which is basically comply with the HIPAA and the GDPR and the CFR standards, and you can use it internationally if you want to use these kind of data capturing. For example, from the cloud you want to fetch the data. So if you want to fetch the data, the European has the GDPR guidelines, so American has a HIPAA guideline. So the beauty of this software, it can align with these guidelines. You can check a particular cloud based where the data set is present there. You can check whether you have to comply with the HIPAA guideline, you have to comply with the GDPR guideline, and then it can fetch out the data remotely that you can work on that. So these are the things, is something which you can collect, manage, and visualize the data set in a virtual environment. And then you have the bioinformatics, again another field. You have the computational modeling based on the bioinformatics model. So you have, I mean, I cannot touch upon that because a whole separate field in which the bioinformatics analysis is done. So altogether, you should have a very good writing skill with the critical thinking. Without critical thinking, you cannot write critically. So without the critical writing, you will not be able to write a good paper. Because nowadays, whether it's a review paper or basic original research, if you are not critically discuss the finding, the paper will keep rejecting. This is one of the causes of the failure, why the people are not able to successfully publish in a good journal, because they are not critically reading. So that's why they are not critically writing their own paper. When you are not presenting anything critically, the editor thinks this is not a good piece of work, so he will reject it initially. So this is something which you have to build in yourself, and this comes only with the good reading. Start reading papers, at least 2-3 papers a month critically. Then you will build critical thinking, and then you will generate new ideas for your own research. Actually, networking is another skill of the good researcher, because nowadays multidisciplinary research is in basically very effective. if you want to publish in like Science and Nature and Lancet like, or JAMA or a New England Journal of Medicine, which are top tier one journal, impact maybe 30, 40. So you need a multidisciplinary team. So that required networking. So networking is another skill set that the researcher should have. The more you network, the more you will increase your worth actually. This is called network mean net worth. So if you have a good network, mean you have a net worth of more. This is obvious. In the soft skill, you should have a good communication, writing, collaboration, time management skill. Without that, you cannot finish your project on time. Now comes a very important point, which is publication. Everybody is rushing towards a publication, but they don't know where to start actually, and they are keep jumping into a publication. And I have noticed people from Dow, people from SMC, they have like 50, 60 publication during their medical studies, which is very, very negative and bad. I can tell because I'm engaged in the top tier publisher like Springer and Elsevier, and even have like a constant meeting with the Scoopers and Web of Science who give the indexing to these journals. They are delisting journals, they are delisting scientists, they are tagging flagging the scientists with integrate in term of which is there is a new index which is called RI, the Research Integrate Index. How can a student at the medical level can generate 40, 50 paper in 2 years? He is not studying their own course. He is just publishing 2 3 paper a month. So why, how? So this means now that's why in if you want to go for the step these days, so they are looking at your publication behavior. If you are doing a lot of first author publication, it's a very negative, and you will get a lot of objection on that. Because how can you generate, because you are very naive enough, you don't have the background of research of the topic. How can you be a either a corresponding author or a first author, and not only like in one publication but like 20 30 publication in 1 year? So that raises a question mark on them. So this is not good. I can tell, I mean, because people will think like this is very good. Oh, he's a very productive person. During his graduation he is publishing 20 30 papers. This is very bad actually. The researcher and the authorities are looking at in a negative way actually. So that's why they are, the Nature group has published a report in which they have phased out scientists who are publishing 200 papers a year actually. And the second phase will come, people publishing 100 paper, and then when it will come eventually, and they are pinpointing universities, they are pinpointing the author's name, and this is very bad for them actually, so for their career. So don't go in this rush actually. I mean, this is my piece of advice. If any person who is in this group or engage with those people, I think this will be the very bad thing for them if they will for example, if a CV comes to me, I want to work with you, and is from a student with these 20 30 publication, I will never take that student, because it's very negative. Because either he's paying, I know how the medical study tough is. How can he getting time to write paper? Because writing a paper, I know it takes time. Writing, doing the analysis takes time. To submit a paper and to address the review, to address the revision, it takes time. How can you draw time beside their own studies? So this is something which is very negative. So keep this in mind. So first step for a beginners, if you are new, if you are naive, start with the case report and LT. Because if you are from third year, fourth year, you have the clinical rounds, you go in awards. If you pick any case which is very rare, so the idea of case study is something which is not reported before, and it is very new. It is something which is rare. So then you can actually do it as a case report. It's very simple. Just write one paper on the one paragraph on the background, and one two paragraph about the clinical presentation, and then add the lab report and add the scans, and that's done actually. So this is how you can start from the beginning with a case report or the letter to editor. And again, the letter to editor means basically you have to give something critically on that published work. Do not do the random. For example, that's why all the good journal have this condition and requirement. You have to write the LTE on the published paper on this particular journal within last 3 months or 4 months or maximum 6 months. So people, what they are doing, for example, hunter virus is nowadays a hot topic. People are starting doing this. I can tell like one example, the recent one from the journal which I am taking care. I'm the managing editor of one of the journal, which is a Q1 top journal in the field in the region. So in the world ranking, it is like in the coming metrics, it will be like 18th or 16th in the field actually. So there is a group of students from Somalia. Last week they have submitted 8 LT. So definitely I rejected all of them actually. So I mean, this is not a like the this is called the paper mill. Actually, it's not machine that you keep generating things, and you, if you know something which is very hard, no, this is not your area. You are a student, you have to do the thing which is suitable for the student actually. So once you are like good enough, or like you think you have a good writing skill, you read a lot, so you then move to a narrative review actually. And after you finish this narrative review stage, then come with the systematic review and the meta analysis. This is SRMA. So nowadays it's good because neither a case report nor LT nor narrative review counts toward your publication. The publication counts when you do the something real science, like do the original research or a basically systematic review with meta analysis, because in the meta analysis you apply the scientific rationale, you apply statistical analysis. That means it's something which is comes under a category of a research. So if you want to build your profile, apart from these two things, which is the initial step, then move to a basically SRMA, and then come with the original research, which could be a qualitative or a quantitative research. So this is how basically, I mean, one should shape up their career. And once you finish your degree, like your MBBS, then you should have, like, if you have like 1 to 2 or maybe 3 publication with the good journal, good impact, and this is sufficient for your career and profile actually. If you have like 20, 30 paper, this is very negative actually. So keep this in mind actually. Change your perception from now actually, at least. Then how can you build your networking? How can you showcase your work? By presenting or attending a conference, because if you're present in a conference, you will meet new people. You will, there are a lot of PIs there who are attending the conferences. You can meet with them. You can talk with the speakers. After listening their talk, come up with some question which is a real question actually. So he will actually grab your attention then. And then how can you, like, if somebody is coming to your poster, you can actually ask them and show your interest. If he's a good like he's from the good nation and good countries and his own lab, so ask and discuss them, ask for his LinkedIn profile and all these things. So these are the things which can make you, you know, more networked. There are a lot of countries are offering Fulbright scholarships or residency fellowships in particular field. US in top, they have the Fulbright program, which is now cut down again. As I said, like last time, last year, they have stopped the Fulbright program in Pakistan as well because of all the cutting of NIH funding. So NIH research grant are always there. So if you are not directly going to compete with the NIH grant, what you can do is basically look at the list of PIs who has got the grant, contact the PI, because the PI now got the NIH grant. Like British at the Chevening scholarship at the master level, if you want to do the master in public and all these things, you can look at the Chevening scholarship, because it's a successful program running through the British Council. Even in Pakistan, a lot of people from Pakistan, they are 6 in that. So you can choose like publicly if you're interested in that. And you have the Commonwealth scholarship. Pakistan was been suspended for a lot of years, now it's been resumed back. So you can look at, like, there are 30, 40 countries, including the Brazil is there, some of the European countries are there. So you can work on the Commonwealth scholarship. Again, it's very long term process. It takes several months to get all the process done, but if it's done, then you are there actually on your task. In the Europe, there is Erasmus Mundus is one of the one. Then Marie Curie. Marie Curie is one of a very famous one, and they have a because in the Erasmus Mundus you have a separate program for undergraduates and graduates. So you can look at, even if you are undergraduate, you can look at some of the like 6 weeks to 6 month internship program there in the different European countries. But Marie Curie is a full-fledged program, and full bright scholarship can be obtained, but it's very competitive. They pay a very good scholarship. Again, Dad already mentioned. Fancy the another one, but it's purely they are posting all the masters and PhD and postdoc fellowships if you are interested in the neuroscience related programs. So FANS is Federation of European Neurological Societies. So they have basically all the program listed there which is related with the neuroscience. In Australia, you have the RTP program, you have the NU already mentioned, you have the PGRS postgraduate research scheme. You can look at these are ANU and PGRS are open one. You can choose any field actually. These are the website. Even you can Google them, like NIH website, Fulbright program US, Fulbright program UK, Fulbright program Australia. You can get a lot of programs. And Chevening is from UK, already mentioned that. Erasmus, so all you can do. And then there is a common portals. If you are looking at only for PhD, so there is a whole website which is called Find a PhD. There is a whole separate website for the Find a Postdoc. So you can actually, if you have done doctorate, you can go into the Find a Postdoc. You can select the field, you can select country, you can select duration, all this through these journal portal you can find that. Then basically you have how to find the research position abroad. So there are a couple of things which I listed here. One is directly you can look at the PI of the particular university, directly email them. Do not make a lot of mistake. I will just wrap up the mistakes in the coming slide. So don't make some silly mistake by when you approach someone through the email. So there are university portal, career portal. They have like research position listed there. You can look at each individual university for a specific position. And then there are professional platform, like a lot of nowadays you can look at many positions by directly by the PIs or even by the university pages. They list different openings into the LinkedIn. So become active in the LinkedIn. You will definitely get a good response from there. Then you follow the web pages, then you follow the forums, you follow LinkedIn, either X pages of the universities and the professors, so that you can get the direct notification whenever they post something. So this is another thing if you want to find very actively. How can you approach a professor? There are certain things. Write a very simple subject what you are interested in. So for example, you are interested in as a research trainee, as a research scientist. If you are like a PhD, you are looking for the master's opening, you are looking for a postdoc opening. So just be brief in the subject line. And in the email body, the first paragraph should be about your introduction with the major achievements. And then second paragraph would be about, like, do not put a long stories, because nobody has time to read your like long stories. So just put your brief research interest and why you are interested in his lab. So just look at his research and put like 2 3 lines. You got like interest because you are working on this, and this is also your interest, and I've also worked a little bit on that, on this thing. Be brief. And then put, like, if you have previously any relevant experience in research, just put that and then attach your CV. That's all. In short, keep like 200 to 250 words. That's all. Otherwise, it will directly go into the deleted item by the professor, because he receives several emails of such type. So he will not read all them. Be very specific to your own and your own profile. Do not be too general, do not be too generic actually. So this is something which is very important. And then this is another session actually, how can you write effective CV. So list down all these things in sequence actually. The education comes first, experience comes second, then list of publication, list of presentation, list of certificate that you have, and lastly you can put your technical skill set. And do not write too long sentences. Use only bullets. That's all. Do not use something which is not relevant to a particular field. Do not use is spelling errors. Do not use for unformatting or formatted issues actually. So these are things that you should have in mind when you write your CV, and it should not more than 2 pages or maximum. If you have something to show, then not more than 3 pages. Now I'm going to give you the roadmap actually what you should do in year 1, year 2, year 3 and 4 5. Learn basic skill. If you're in year 1, join some project. If you are some project going on your university with the seniors, and then build a good profile actually in the research guide. In the year 2, what you can do, if you seek out if there are in around any research assistantship, because there are certain universities, like for example in Karachi University, they have the 6 weeks. Now they have announced it. So they have like 12 to 13 different discipline, in which stem cell, neuroinformatics, and electrophysiology, and the western blotting, and the molecular biology. They have a various internship offer for the undergraduate students. So you can apply there and see if you can seek that. Khan has one of the internship program. So Shaukat Khanam has an internship program. So you can look at these places, and if they have. So if you have something in hand, then try to present it in the conference. That is a good for you. In the year 3, what you can do, I mean, this is something when you plan your career as a researcher. start looking at the master's position, and then so that you can shape up your profile accordingly. So this is done through very good networking. If you are connecting yourself internationally through LinkedIn, through webinar, because there are a lot of portals which are doing constant webinars. So you can connect those portals, attend their webinar, be in touch them, so that you will be in a good book of them. Common challenge and solution. For example, people comes always with me, I have no publication, what should I do? Simple, start a case report. Because if you are doing the elective and you are in a ward, so just pick up the case and then start there. So at least next time you will not say I don't have publication, at least you can say I have one case study. And if you are really good enough in writing, start with the review, narrative review, because you don't need to go for ethical approval, you don't need to seek other collaboration. You can start a review under someone which is senior in the field, so that he can guide you. Because nowadays students are doing only solo paper. Solo paper mean only single author paper. Single author paper is something which is again a bad patch for your career, so don't do that if you are a very beginner actually. So start the review if you have a good knowledge of the subject or topic. Second thing, I don't know who is the mentor. Yeah, this is a problem in Pakistan. The teacher are busy; they do not give the time. So this is something which is really challenging. So what you can do, you can look at the global portal. There are some groups who are basically, there are student bodies who are basically mentoring student. Nowadays, some journals also started some initial mentorship program for the beginners actually. So look at those portals from internet. Spending time on internet productive in a productive way is something which is our youth is missing. They are spending time in chatting and using time to watch the reels and YouTube for other stuff. So this is something they are actually killing their time, missing their time actually. So explore, everything is there actually. You have to find and explore. Third thing is I lack funding, because I want to do masters but I don't have funds to go abroad. I want to do PhD but I don't have money. Then explore for the scholarship actually. And before exploring scholarship, you should shape your career or your CV, so that your profile should be competitive enough that you can qualify for the scholarship. So what you can do now, start looking at when there is a PhD scholarship is there, what is their requirement actually. So shape your CV according to that. Sometimes I tried a lot. I am very, very disappointed because I'm overwhelmed. I'm busy in other stuff. I have basically, because I'm the RMO, I have the shift of 32 hours, 36 hours. Man, time management. That's why I said, like, time management is another skill. So you should build your day and night tasks according to your own routine and your passion and your destiny. If you don't, as I said, like, it's not a journal thing which can replicate on everyone. You have to look at your own schedule, own scenario, own capabilities, and build your own time schedule to achieve all these things apart from work life balance. When you want to aim your career as a researcher after like graduation, so what you should do is you develop your pathway, which is research focus, and that is achievable as per your own skills, not on the experience from others, because others have the other skill set and other scenarios. Maybe they have no binding from liabilities of the family. You have a strong liabilities on your family, on your shoulder. You have the economic constraint. So never replicate someone else. Build your own pathway. Always adopt the smart goals that you can achieve in a consistent passion way. Because there are sometimes some people fix, okay, I want to do this and that. They are passionate, but they should consistently achieve it. If you are not achieve anything in your consistent time frame in 1 year, you will get demotivated and disappointed actually. Third thing is basically you have to smartly do your publication, and you have to build your good network from the good people actually, otherwise they will waste your time. Third is basically you have to approach the international opportunity. You know the portals, you know the PIs, you know the university career portals, you know the organizational portal, so that you can know the position advertised there, so you can apply there. And third, and sorry, the fifth and last is basically you have to build your academic excellence through your knowledge. Without knowledge, you cannot gain anything. So if you want to progress and build yourself, build your knowledge base to an effective level. So this is how basically you can be a good researcher. Yes.
Well, thank you so much, Dr. Rafa. This was a very, very informative session and very like mind opening too, because the thing about those researches and all that, students are actually running behind like 20 plus researches and all. So that was very eye opening to know that, okay, that's not what we should be doing. So that's a very nice
Hopefully.
take home message, and everything else was perfect. It was a very, very nice session. And since we don't have a lot of time left, we can't like manage the question and answer session right now. So if anyone has some questions, they can contact me, and Dr. Liaquat, I'll connect them to you. Okay,
Okay,
so
sure, sure.
that works. And
Thank you.
thank you so much, Dr. Liaquat, once again, and a very, very amazing session. And thank you so much. Thank you so much. And thank you
Thank you,
everyone for
everyone. Thank
joining
you.
us. Thank
Thank
you.
you.
So
Thank
we'll
you.
end it here, guys. Have a nice day. And again, thank you, sir.
Thank you.